So obviously we've come on this journey. We've talked about some of the amazing things that we hope to achieve and some of the great outcomes we're going to deliver. And now we're getting into the actual deployment and the rollout of this. I was wondering if you can just talk about, the approach, and certainly I can share in terms of the partnership as to how that's going to look and feel for the organisation itself. But hearing from your perspective as to how are we going to roll this out and how's that going to look and feel?
Sure. So we've taken our time to really understand the challenges, obstacles, and the benefits that homes are going to face in order to plan that rollout. So we've been doing something called real world testing, and we've been doing that since July in 4 sites, one here, Douglas View in Scotland, 2 in England, Shortland Place and Clarendon Hall, and 1 in Wales, Aberpennar. And we've been running that testing, working really closely with the managers. The team have been listening to the managers, taking their feedback, changing parts of the system to make sure it's operationally viable and gives them the outcomes they need. And colleagues from Radar Healthcare have come to each of the 4 sites with us to listen and understand and get that feedback and literally make amendments to the system as we've been talking to the managers. So it's all been fed from the managers about what's important to them and the area directors. And certainly in Wales, we also have a regional director giving us some really interesting feedback. As we move forward, we start our rollout to all of our homes in October. And we've got a really active rollout plan that will last 8 weeks across 280 something homes. We're going to support homes by giving them an individual training session that's individual to them on each of their day of rollout. And we've got a support function behind the scenes about how we're going to support them, how they can reach out for help, etc. But the feedback we've had from all of our testing sites is that this is really easy, and they've taken to it really well, and it's all quite instinctive. So that's our rollout plan. And so by the end of November, all of our sites will be active with Radar. And we're also currently working on building all the analytical dashboards that people will find useful and valuable for all the reasons we've talked about.
Fantastic. I mean, personally super excited. And I suppose it must give assurance to those that are going to be receiving the system that this has been done in a way with, this isn't done in isolation, of the organisation. This is absolutely, within each of these care homes that you mentioned, and the people that represent everybody else in the organisation that's going to use this on a daily basis. So I think getting assurance that as we find the ways and the nuances that invariable that come out home by home, we can still accommodate those, but the foundation of the system and the configuration and the methodologies they roll out is based on HC1 and the people that work within HC1.
Yeah, absolutely. And working on the very foundation that this has got to work for the home manager. This has got to give the home manager and their teams the information they need to make those improvements we talked about. So if we don't get that, we would have failed. So it's really important we've taken our time working in partnership with yourselves to get to that point. And ultimately, if we can't improve a resident outcome, there was no point doing any of this. So again, what we've been doing during the real world testing phase is to make sure that what we're learning is going to improve a resident outcome. So the feedback we've had from the managers and their teams has been absolutely valuable in doing that. So I'm really confident and assured that we're going to have a system that's been really built around the individual resident with that feedback from the people who actually deliver the care.
I mean, if I was going to give any assurance, to the staff of HC1, I would say this as well. Not only is that hard work and hard yards been put in before Radar Healthcare is rolled out, but rest assured that as part of our partnership and one of the demands HC1 put on Radar Healthcare was this has to be able to be iterative.
Yes.
So we can't have a fixed system because the world evolves. You have nuances through different regulators in different regions, and they have to be accommodated. So my kind of assurance to those workers, if it doesn't work or it's not working in the best way for you within your organisation, then there is the capability and capacity to make those changes within a controlled way, of course. But
yeah. And that comes back to the partnership approach, doesn't it? Because it's about, this isn't just a one-off. Here's a system. Thank you very much. Off you go. this is a constant evolution, you know, and as we bring in Nourish to sit alongside Radar and integrate with it, that again will involve more evolution.
Yeah.
And as you say, you know, the nature of our residents will change in the future. The demands of our regulator will change. They are changing currently. The demands of our commissioners will change. But fundamentally, we just need to have a partnership where we can keep evolving and meeting those expectations, but still allow us to deliver those outcomes for people.
I think another kind of, you know, less tangible benefit as well is we alluded to it earlier in the conversation about the community.
Yeah.
And, you know, it's not just HC1, it's lots of organisations. But if you bring it back to HC1, again, for, you know, that the assurance of, you know, the carers, the managers, it instantly creates a community where you can communicate across all homes, or where people have found best practice, a way of doing something that can be shared, quickly deployed, measured. If it's effective, then it's rolled out. So whilst at individual locations we're driving improvement and change, improving resident outcomes, holistically the whole organisation, and I know that's a commitment on both our sides to drive that holistic change.
And if you just think about where we are today in Scotland, the regulatory framework in Scotland is very, very different to England, and is different again to Wales. And the regulations are different. The way they assess the quality of care is very, very different. And there's huge opportunities to learn. So, for example, in Scotland, the whole regulatory framework is very much around the rights of people and their rights to autonomy and independence. And whereas the English framework isn't quite like that at the moment. But there's great opportunities to learn from what goes on in Scotland and how they manage incidents and how they drive that improvement to meet the expectations of the regulator. If we share that learning into England, that will also drive the care up.
Yeah, and I think that's something our commitment as a technology partner to HC1 as Radar Healthcare is, because we have such a broad mix of partners and internationally as well. Yeah. And like we talked about excellence. Excellence was driven actually from within the Emirates.
Yes.
So we've seen within the UAE where they were successful in driving that because they saw the impact it had on the resident stroke patients. So it'll be things like that we collaborate on. And I'm absolutely certain of this, that we'll be sharing things that HC1 have done and pushing that out to the community. So collectively, we all learn, the net outcome being we improve, you know, patient and resident outcomes.
Absolutely.